Finding mental health help. Paz shares how mental health care can be different for people with IDD. Between 30 and 50% of people with IDD also have mental health conditions. People with IDD are more likely to have mental health conditions than others. People with IDD are less likely to seek treatment. Getting help can be frustrating. It can be scary. It might not seem worth it. But there is hope. Tell us a little about who you are.
I have autism and anxiety and depression. I'm a college student. I identify as genderqueer, and my pronouns are they, them, and I'm asexual, aromantic.
What has been your experience with mental health care?
I think that due to my diagnoses, that I'm not able to convey my needs in a way that somebody without autism or anxiety or depression would be able to. And most of the time, I need an advocate to speak with me on my behalf.
Is treatment different for people with IDD?
While it can be different from person to person, I do believe that people with IDD deserve to have extra time to get to know their therapists and doctors, because we communicate differently. We get to know people differently. And if there's been a bad treatment response in the past, it may take even more time to build up that rapport.
Have you ever sought treatment?
Yes, I've sought treatment at various times throughout my life, and I've learned to be in tune with my needs. And if I feel like I'm starting to spiral, I reach out to a parent or a teacher or a doctor.
What advice would you give others about seeking treatment?
I know that it's hard, it can be intimidating. Sometimes you're too prideful, but you have to do what's best for yourself, and also, to a certain degree, what's good for the people around you.
Finding the right mental health support is important. It doesn't have to be hard or frustrating. You can find the right mental health provider for you. Learn more at mhhelptx.org. That's mhhelptx.org.